Hey everyone, in this video we're going to discuss the different long-acting injectable options available for risperidone. And we'll start off with the background of risperidone, then talk about the three different options commonly used in the United States, and discuss some of the high yield points associated with risperidone LAIs. I'd also like to clarify that everything discussed in this video is intended for informational purposes only and shouldn't be considered medical advice. Additionally, the dosing information shared later in the video is based on manufacturer guidelines and doesn't reflect any real-world patient treatment experience. So risperidone is known as a second generation or atypical antipsychotic in terms of its mechanism. It acts by antagonism at the serotonin 5-HT2A receptor and the dopamine D2 receptor. In terms of side effects to be aware of, these include sedation, weight gain, hyperprolactinemia, metabolic syndrome. Of course, there's a lot more to be mindful of when considering risperidone, but some labs to consider as well include BMI, waist circumference, A1C, blood glucose, lipids, and prolactin. So we'll start off by talking about Consta, and I've tried to organize each of the three injectables in the same way to make things as clear as possible. So in terms of FDA indications, Consta is indicated for schizophrenia as well as monotherapy for bipolar 1 or adjunctive therapy to lithium or valproate for bipolar 1. Dosing options available include 12.5, 25, 37.5, and 50 milligrams. It's administered either as a deltoid or a gluteal injection, and it's given every 2 weeks. The important thing to consider with Consta is that it requires an oral overlap of 21 days. So you want to give oral risperidone with the first injection, and then you want to continue oral risperidone for the next 20 days. When it comes to conversion from oral risperidone to Consta, you want to consider two different categories, the first of which is patients on oral risperidone of 4 milligrams or less. For these patients, you can initiate 25 milligrams intramuscularly of Consta every 2 weeks. If there's an inadequate response to that, you can increase to 37.5 milligrams or 50 milligrams. The next group of patients would be those who are on greater than 4 milligrams of oral risperidone. For these patients, you can consider another LAI, such as Perseris or Uzedy, or you could start them off on 25 milligrams of Consta every 2 weeks, and then titrate them to 37.5 or 50 milligrams if that's needed. Next off, we have Perseris. So FDA indication is only for schizophrenia. There are two doses available, 90 and 120. And it's administered as a subcutaneous injection in the abdomen or the back of the upper arm. It's given every 4 weeks, so it's a monthly injection, and there's no overlap as compared to Consta, which did require that overlap. In terms of conversions, so if a patient is on oral risperidone 3 milligrams, then they would be given a 90 milligram Perseris monthly. Or if a patient is on 4 milligrams of oral risperidone, then you could do 120 milligrams of Perseris monthly. Next off, we have Uzedy. So Uzedy is indicated for schizophrenia. Dosing options available include 50, 75, 100, 125, 150, 200, and 250. It's administered as a subcutaneous injection in the abdomen or the upper arm. And the unique thing about Uzedy is that it can be given every 4 weeks or every 8 weeks. So kind of something that sets it apart from the other options available and could be a good option for those who, don't want to go in and get their injection frequently. They have this option of getting it every 2 months. And similarly to the Perseris, there is no oral overlap for Uzedy. So when it comes to conversions, if a patient is on 2 milligrams of oral risperidone, you can either do the 50 every 4 weeks or the 100 every 8 weeks. If a patient is on 3 milligrams, they either do the 75 milligrams every 4 weeks or the 150 milligrams every 8 weeks. If a patient is on 4 milligrams of oral risperidone, then they could do the 100 every 4 weeks or the 200 every 8 weeks. And if a patient is on 5 milligrams of oral risperidone, they can do 125 milligrams of the Uzedy every 4 weeks or 250 milligrams every 8 weeks. So you've probably noticed the pattern by now. If you're able to kind of memorize the 4-week dosage, then you could just double it and that'll give you the 8-week dosage. So these are the conversions that we just discussed, put onto one slide to kind of help you memorize the different conversions available. So some high yield points that are important to remember are that all three of the injectables discussed are indicated for schizophrenia. What differentiates them is that Consta is indicated as monotherapy for bipolar 1 or as an adjunctive therapy to lithium or valproate for bipolar 1. All three of these options discussed require refrigeration and Consta requires an oral overlap of 21 days. And then, of course, the schedule that we discussed. So Consta is given every 2 weeks, Perseris every 4 weeks, and Uzedy is either every 4 weeks or every 8 weeks. The last topic I wanted to discuss in this video is on the Paliperidone and the Paliperidone LAI. So you may recall that Risperidone gets metabolized into Paliperidone, so that's the active metabolite. And Paliperidone itself is also available as an LAI known as Invega. And I won't go into too many details about Invega, but I do want to mention that you can actually go from oral risperidone to the paliperidone LAI. Specifically over here, we're talking about Invega Sustenna. And this could be for whatever reason, whether that's a patient not having a good experience with the Risperdal LAI or wanting to try something new. This could be a good option for them. So the idea between going from oral risperidone to Paliperidone is that you want to start off on day 1 with a 234 milligram injection of the Invega. And then this says day 8, you want to give 156 milligram. In reality, this is day 8 plus or minus 4. So anywhere from day 4 to day 12 or anywhere in between, you can kind of give the second injection of 156 milligrams. And then from there, depending on whatever oral dose of risperidone the patient was on, you can decide what their monthly injection of Invega Sustenna is going to be. So if they were on 3 milligrams of oral risperidone previously, their monthly injection of Invega Sustenna will be 117 milligrams. And that's all I wanted to discuss for Paliperidone. Just something that may be good to know in the back of your mind. Thank you so much for watching. I hope this video was helpful. If you have any questions, please feel free to leave them below. Thank you.